Pregnancy is a transformative journey, brimming with anticipation, hope, and meticulous planning. It's a time of immense joy as you prepare to welcome a new life into the world. The due date becomes a major milestone, a focal point around which all your preparations revolve. It's the date you eagerly await, marking the culmination of this incredible journey. Sometimes, though, despite all the planning, babies decide to make their entrance a little earlier than expected. This is clinically referred to as preterm labor. Understanding this possibility is crucial for every expectant parent. Preterm labor signifies that your body is initiating the preparations for childbirth prematurely, specifically before the completion of 37 weeks of gestation. This is a critical threshold in fetal development. It's characterized by the presence of regular and persistent contractions, accompanied by noticeable changes in the cervix. Babies born prematurely may require specialized medical attention and care, primarily because their vital organs, with particular emphasis on the brain, which undergoes significant development in the final weeks, the lungs, essential for independent breathing, and the liver, responsible for crucial metabolic functions, are not yet fully mature and prepared for life outside the womb. The earlier a baby is born, the greater the potential for health-related complications and challenges. A comprehensive understanding of preterm labor empowers you to actively participate in decisions regarding your health and advocate effectively for your baby's well-being. Braxton Hicks contractions, often described as practice contractions, are a common occurrence during pregnancy and are generally harmless. However, true preterm labor contractions exhibit a regular pattern, progressively intensify in strength, and crucially, do not subside or diminish with rest or changes in position. Being able to differentiate between these types of contractions is paramount in determining when it's necessary to seek immediate medical attention. Staying informed and educated empowers you to be an active participant in your care, fostering a collaborative partnership with your healthcare team to achieve the most favorable outcome for both you and your baby. In the following sections, we'll provide a comprehensive guide walking you through the warning signs of preterm labor, exploring the underlying causes and potential risk factors, and highlighting the various support systems and resources that are readily available to you. Equipping yourself with knowledge and understanding prepares you, not to succumb to worry or anxiety, but rather to act with confidence and assurance, ensuring the best possible start in life for your precious baby. As you journey through pregnancy, many questions might arise, especially concerning the signs your body sends. Many parents wonder how to tell normal pregnancy discomforts, those everyday aches and pains, from the signs of real labor, and what to do if labor starts early. True labor, whether it's preterm or full term, is a distinct process. It brings persistent, specific symptoms that differentiate it from typical pregnancy-related discomfort. Recognizing these signs is crucial for ensuring the best possible outcome for both you and your baby. Normal labor typically starts with contractions that gradually grow stronger, last longer, and become closer together. This is often accompanied by a bloody show, which is the release of the mucus plug or the breaking of your water. Preterm labor, on the other hand, feels similar in many ways, but it happens before 37 weeks of gestation, which is the key difference to keep in mind. Ultimately, timing is the key difference that sets it apart from normal, full-term labor. Preterm contractions are often regular, and they don't stop with rest or a change in position. These contractions may come every 10 minutes or even more frequently, signaling that your body might be preparing for early delivery. There are several warning signs to be aware of before 37 weeks, and it's important to familiarize yourself with them. These include experiencing 4 or more contractions in an hour, which can indicate that labor might be starting prematurely. Another sign is a constant lower backache that doesn't subside with typical remedies. You might also feel pelvic pressure, as if the baby is pushing down, or experience menstrual-like cramps. It's also crucial to watch for any changes in vaginal discharge. Be alert for an increase in the amount of discharge, or if it becomes more watery, bloody, or mucus-like. Remember that symptoms can sometimes be subtle and easily dismissed. You might just have a nagging sense that something isn't quite right, even if you can't pinpoint exactly what it is. In these situations, it's important to trust your instincts. Don't hesitate to call your doctor or healthcare provider if you have any concerns. It's always better to get checked out and be reassured that everything is okay than to wait and potentially risk complications. Remember, your healthcare team is there to support you throughout your pregnancy journey. Taking early action when you notice potential signs of preterm labor can make a big difference in the health and well-being of your baby. Stay alert to your body's signals, advocate for yourself and your baby, and don't hesitate to seek medical advice when needed. Why does preterm labor happen? Often we don't know, but some risk factors are clear. The biggest predictor is a previous preterm birth. Other risks include carrying multiples, uterine or cervical issues, high blood pressure, diabetes, and infections. Lifestyle factors matter too: smoking, drug or alcohol use, high stress, and extremes of age. Racial disparities exist, with Black women at higher risk due to complex social and healthcare factors. Knowing your risks isn't about blame, it's about awareness and action. Many risks can be managed with your doctor's help. Even with risk factors, preterm birth isn't certain. Stay proactive and work closely with your healthcare team. If you have symptoms of preterm labor, your medical team will act quickly to assess you. They'll monitor your contractions and your baby's heart rate. You'll be asked about your symptoms and health history. A pelvic exam checks for cervical changes, and a transvaginal ultrasound may measure cervical length. A fetal fibronectin (FFN) test can help predict your risk of early delivery. A negative FFN test means you're unlikely to deliver soon, which can be reassuring. A positive result means closer monitoring. Sharing all your symptoms helps your team make the best decisions. Quick, thorough evaluation is key to protecting you and your baby. If preterm labor is confirmed through examination and monitoring, it's natural to feel anxious. The immediate goal shifts to delaying birth, even if only for a brief period. Every day, every hour, counts. This delay allows for crucial interventions that can significantly improve your baby's chances. Tocolytic medications, administered intravenously, may be used to slow down or even temporarily halt contractions for a few days. These medications help to relax the uterine muscles. This window of time is invaluable, allowing for vital treatments to be administered to both you and your baby. Most importantly, it provides the opportunity to administer corticosteroids. These powerful medications work to speed up your baby's lung development, a critical factor for survival outside the womb. Steroids greatly reduce the risk of serious breathing problems, such as respiratory distress syndrome, in premature babies. This can significantly improve their chances of a healthy start. Magnesium sulfate may also be given, particularly before 32 weeks of gestation, to provide neuroprotection and help protect your baby's developing brain. It's important to be aware that side effects for you are possible with these medications, but the potential benefits for your baby's health and well-being are significant and generally outweigh the risks. If delivery becomes unavoidable despite these efforts, you may be transferred to a hospital equipped with a specialized neonatal intensive care unit, or NICU, to provide the best possible care for your premature infant. These specialized teams of doctors, nurses, and other healthcare professionals are specifically trained and equipped to care for premature newborns and address their unique needs. Throughout this process, the primary focus is always on achieving the safest and healthiest outcome possible for both you and your baby. Modern medicine offers a range of powerful tools and interventions to help even the tiniest of arrivals thrive and grow stronger each day. While not all preterm births can be prevented, you can take steps to lower your risk. Start with early, regular prenatal care. Don't skip appointments. Eat a balanced diet, stay hydrated, and avoid tobacco, alcohol, and drugs. If you need help quitting, ask your doctor. Support is available. Manage chronic conditions like diabetes or high blood pressure closely. Take care of your dental health, as gum disease is linked to preterm birth. Manage stress with exercise, mindfulness, or counseling. Listen to your body, rest when needed, and ask for help if your job is physically demanding. Build a support system with family and friends. Advocate for yourself and communicate openly with your healthcare team. Every positive step supports a healthy, full-term pregnancy. Trust your instincts. If something feels wrong, act quickly. Call your doctor or hospital immediately if you have warning signs before 37 weeks. Regular contractions, backache, pelvic pressure, cramps, or unusual discharge. Don't worry about overreacting. Your healthcare team wants you to call. Be ready to describe your symptoms clearly and specifically. Early detection gives your baby the best chance for vital treatments to work. Don't wait to see if symptoms go away. Time matters. Your vigilance is the first step in protecting your baby. Being informed builds confidence, not anxiety. With knowledge and teamwork, you're giving your baby the best possible start. You're not alone. Support is always available for you and your family.